Hello, welcome to my YouTube channel, and today I'll be discussing about very important points related to vaccines and vaccine schedules in Step 2 CK that are very high yield and that are updated. So if you are about to give your exam and you want to do your quick revision, so please subscribe my videos and follow my vaccination videos and guidelines that I'll be talking about. So now, if the question says that an individual is traveling to Mexico after 4 weeks, so what vaccine you should administer them to prevent a particular disease? And in the options, you do see Hep A vaccine. So you're going to select that because Hep A is endemic in Asia, Africa, Mexican, and all these regions. So you're going to select that. Okay, now what's the pre-exposure prophylaxis is that you have to give Hep A vaccine to an individual who has to travel to an endemic region where Hep A is present. Okay, so where Hep A is endemic, so you have to give them if it has been more than 2 weeks, or if it's more than 2 weeks that he has to travel to that certain place. So you have to give it. Then if there are more than 2 weeks left for the person to travel, okay. So they're traveling to any country in which HIV is endemic, all children more than 12 months of age. And if someone has a potential occupational exposure to HIV, or if someone is in close contact with an individual who belongs to a country in which HIV is endemic, so you have to administer HIV vaccine in more than if there are more than 2 weeks left. Okay, so individuals who had an increased risk of severe disease includes individuals with chronic liver disease or a Down syndrome more than 12 months of age with HIV. And Hep A vaccine is considered suitable for use during pregnancy as well. So remember that, okay? That's how you can prevent. And normally, in children between 12 to 23 months of age, they're given 2 doses of Hep A vaccine that are 6 months apart. Okay, now if someone has been exposed to Hep A, so post-exposure prophylaxis is recommended to individuals who have never been vaccinated previously or for Hep A, or who have been in contact with an individual that has serologically confirmed Hep A within the past 2 weeks. So Hep A is a notifiable disease, remember that. So types of post-exposure prophylaxis, remember that active immunization. What is active immunization? It's like in which an active immunity, like in which the body's immune system itself reacts to the presence of antigens by producing antibodies. Okay, so the immunity lasts for years or even a lifetime. And active immunization consists of live attenuated vaccines, inactivated vaccines, whole vaccines, subunit like protein-based polysaccharide vaccines, viral vector vaccines, and nucleic acid vaccines. Okay, so remember that for post-exposure prophylaxis, you have to give active immunization is always given in individuals who have no contraindications to live vaccines, who are not immunocompromised, who have no immunodeficiency. Okay, so it's always given in individuals who are healthier and in between 1 to 40 years. Passive immunization and immunoglobulin is preferred in individuals who are immunocompromised or who have contraindications for vaccinations, or if they are infants less than 12 months of age, that's when you give them passive immunization and immunoglobulin. Both active and passive immunization is considered in individuals who have chronic liver disease or if they're immunocompromised, but you have to consider it in adults who are more than 40 years of age, and it depends on what kinds of risk factors they have. Okay, so if someone is traveling to South America, Africa, Europe, Eastern Europe, Mexico, Central America, they have to be vaccinated with Hep A because it has a higher prevalence of Hep A, so they have to be vaccinated with Hep A vaccine more than 2 weeks before traveling. And individuals who are due to travel in these areas in less than 2 weeks, they require both HIV vaccine and an immunoglobulin. Remember that, which should be administered at different anatomical sites. And how is HIV transmitted? By the consumption of food or water that has been contaminated with feces. So Travelers should also be advised to take preventive measures, primary preventive measures like chlorinating water, drinking wild water, washing hands, all of that. Okay, so if it's less than 2 weeks, you have to give Hep A vaccine with immunoglobulin. If it's more than 2 weeks before traveling, you have to just administer Hep A vaccine. So I hope I made that clear. Also, if they mention that a child, like a 5-year-old child, um, has a close contact with someone at home who got Hep A, so should he be vaccinated? Though his vaccine schedule is all updated and he has gotten all his vaccines, so should he be given a Hep A prophylaxis vaccine? So in that case, no, since a child is vaccinated for all the vaccines and he is like 5 years old. So in that scenario, as I mentioned earlier, that Hep A vaccine is given in between 12 months to 23 months of age, 6 months apart. So if 2 doses are given already, that is enough to confer long-term immunity. So if they're already vaccinated with 2 doses at the passage of 6 months, so it does not require any more prophylaxis, post-exposure prophylaxis. Okay, and no steps are needed according to CDC. So once again, the combination of the HIV vaccine and immunoglobulin that I mentioned previously, that is passive immunization, is only indicated as post-exposure prophylaxis in individuals who are immunocompromised or in children who have not been vaccinated or have been exposed to HIV in more than 12 months of age. Okay, so in that scenario, it's recommended. And adults who are immunocompromised or if they have chronic liver disease or have not been previously vaccinated. So if someone is already vaccinated or with their complete immunization schedule, then you do not have to give them anything. Yeah.